My philosophy of patient care, I would say holistic. Most physicians, I think, are concentrated on the problem at hand, and I think that's definitely important to keep in focus, what the patient comes in, and the problem that they have at that given time. But I think what sets me apart from a lot of people is that I'm focused more on the whole person and all of his or her problems or issues that they have that may relate directly or indirectly to their problem of cancer. I think that it's really important to understand the patient as a person and as an individual so you can best serve their needs and best make sure that you maintain their quality of life during the time that they're being treated for cancer. The favorite aspect of my job is how far cancer has come, The favorite aspect of my job is how far cancer care has come over the last decade. I've seen a lot of changes happen that have been really exciting, and I've seen the whole field of cancer care evolve in such a positive way so that we're seeing so many patients who before had very little hope of surviving, very little hope of getting better, now leading very high quality and productive lives long into their diagnosis of cancer and long beyond where we would have expected them to even still be alive. And so that's really exciting to me, and it's exciting to be a part of delivering that care to them. My main motivation is that every patient that I see come in my door, I treat them like a member of my own family. And I've had a lot of cancer come through on my side of the family and in my wife's family, and we've had very good friends and relatives that have been affected by cancer. And so those are the people I see when someone comes in to the door to see me for their initial consultation. I think it's really important to establish that connection. I feel that connection very deeply when I'm seeing someone for the first time, and really my motivation is to help them through, but also to help their family members, to help them and to know what to do and how to help and how to care for them in these different stages that they may go through. So yeah, it's really important family education during this entire process, because what I tell patients is that when they come in the door for their diagnosis of cancer, the information's coming at them and it's kind of like trying to drink from a fire hose. And so I think that what's really important is that they have someone who's there, who's able to take notes, who's able to ask questions that they may not be able to think about at that point in time because they're in crisis. And being able to repeat things and being able to make sure that everybody understands what the game plan is, and being able to make sure that there's just a firm understanding that everybody's on the same page and that we're going to move forward together as a team. Family members are incredibly important in that process. CyberKnife treatment is probably the single best tool I have as a radiation oncologist that goes beyond the standard treatments. In other words, when there is someone who has survived a cancer or has a recurrence of cancer, or who has an area of where the cancer has spread somewhere in their body, the tool that is most often called upon to address that situation, that very, very special situation for which there is no answer in any textbook, is the CyberKnife. It is the technology that allows me to treat things that were previously untreatable. And it's very, very exciting because I'm able to not only talk to patients and educate them about it, I'm able to educate my colleagues about it. Other oncologists that are not in the radiation specialty may not know that the hope exists to treat something that typically in decades past hasn't been able to be treated. So I think it's really important as a weapon against cancer and as the kind of weapon that we're able to use to treat things that previously we haven't been able to. Working at the Brown Cancer Center, I have to say, has really been a privilege, because I've been able to see the quality that you would be able to see at any national comprehensive cancer center, in terms of people working together, in terms of people who are subspecialty trained, and in terms of people who have intimate, direct knowledge of the most complicated illnesses that are out there. working here has really taught me a lot about how to best coordinate the patient's care in a very complicated medical universe, how to integrate their care with their other subspecialty treatments such as chemotherapies or surgeries, and how to make sure that patients get from point A to point B all under the same roof and all with a team that is used to working together and providing excellent care as a coordinated team.